Hey, good morning, everybody. I'm Evan. This is Ryan, and that's Levi. And we're going to be talking about quad force development in ACL-R patients after implementing optimal prep training strategies. We have nothing to disclose. So if you tear your ACL, you are 33% more likely to either re-tear or tear the contralateral limb. Having dysfunctional quadriceps is an indicator of this, but we don't really understand it that well. We think that implementing motor learning strategies can have an impact on quadricep function because these processes are typically ignored during traditional ACL rehab. So like these motor learning strategies are more of a holistic approach, while traditional is more local. And an example of these motor learning strategies is optimal prep, which has been going since 2016, so it's fairly new. It consists of three pillars. Two go under motivational, and then one goes under attentional. So this down here is an example of optimal prep. And those three pillars are enhanced expectancy, which is providing some kind of positive outlook. So like this patient would be told that if she keeps that blue bar in the green, she's going to have a positive outcome. Autonomy support is simply having freedom of choice. So in this example, she chose to do the Bosu squat. And then external focus is having like some kind of movement that will have an effect on the environment. So here she's just trying to keep that blue bar parallel, but it can be as simple as focusing on a target, or like a quad set, like driving the back of your knee through the table or something like that. So our hypothesis is that optimal prep will result in greater quadricep and hamstring peak torque compared to the control condition, as well as a benefit in the uninvolved limb. Our participants were consistent with those of college-age students. We had more females than males, with majority of those being non-contact injuries. Our inclusion criteria: what you have to be cleared for activities of daily living and sport, as well as being over the age of 18. Exclusion criteria was you can't have torn or retorn your repair or have a tear on the contralateral leg. And then each participant had to fill out the IKDC, Tegner, and Lysholm surveys. And then the Tegner having a 7.54 score means that they're recreational athletes and they were involved in some kind of like cutting or lateral movement activity.
Okay, so I'm going to talk about the study design. We used a randomized crossover counterbalance study. We had each participant started in the experimental condition or the control condition. There were 7 that started with the control condition at first and stayed to the experimental. And we kind of use this study design to kind of combat the organ effect, as well as like the fatigue effect or learning effect. So our methods, we were looking at quadricep and hamstring function using the Biodex isokinetic machine, which isokinetic means the speed remains constant no matter how much force is applied. And we use this because it's important, obviously, in the return to play criteria with ACL injuries. We tested their non-affected limb first on all participants, and then we ordered them with our experimental or control condition. We gave them a practice trial to familiarize themselves with. And then we had them do 5 sets or 5 reps of where we had them kick out the leg as hard as fast as possible and pull back in. That was our instructions with that experiment. Okay, so how did we deliver optimal prep? So we delivered optimal prep. We kind of lumped enhanced expectancy and external focus together. We stated that, or instructed our patient, that research shows that if you focus on moving this liner bar, you will exhibit greater quadricep output. We kind of focus on external focus by focusing on the moving this liner bar. And then our enhanced expectancy was we tried to reinforce that positive outlook by stating the research will help improve this quadricep output. And then our autonomy support, we had them choose a choice of graph, which we provided here, as you can see. And we just let them choose that to see which one they would be most comfortable with, most familiar with. So our data processing, we used EMAT norm filters. We looked at these 5 variables. We have one that's not on there, is rate of force development. It and peak Newton meters, which is peak torque, is our primary focus of this study. But these are the variables we took, and we obtained all variables in all 4 conditions. Okay, so statistical analysis. So we use histograms to assess the data as well as 4 2x2 within subject repeated measures of ANOVA. We, like I said earlier, we look for peak torque and quadriceps and hamstrings as well as rate of force development. And since this is an exploratory study, we didn't necessarily focus on the p-value as much, but since our sample size was so small, being 13, so we wanted to look at an effect size in which we want to see a moderate to large effect size, which would be 0.06, 0.13. Large would be anything over 0.14.
Okay, so getting into the results, when we were testing the quadricep peak torque, we saw that the involved limb benefited the most from our experimental optimal prep condition. Although it's not a statistically significant data point, there was a moderate to large effect size primarily driven by that involved leg improvement. So we can see that there's an interaction because those lines went across there, and our effect size is 0.13, which is pretty moderate to large. Okay, for our quadricep rate of force development, we saw that there was no side or condition effect at all. Really no interaction going on either. And we can tell that there's the effect size here are almost completely insignificant. And again, those lines being parallel, they're not going to cross, so there's not really an interaction between the side by condition. Okay, for our hamstrings peak torque, we saw that our experimental condition improved peak torque for both the involved and uninvolved limb, but again, with them being parallel lines, there's not really an interaction effect between the side by condition either. That's a very small number for our effect size. Okay, and just like with our quads, our hamstring rate of force development, there was really no interaction effect between the side or condition. Again, probably not going to, or mostly parallel, very small effect size. We did have an effect for the side and the condition, just no interaction between. Okay. So our values were lower than that of previous literature, but they do share the same relationship. So injured leg being weaker than uninjured leg. So injured being weaker than uninjured leg in ours. And these can be good predictors of second ACL injury and development of osteoarthritis due to like the impaired motor function, reducing your ability to react to outside forces. So for example, if you're doing like a squat jump landing, if you're deficient in your quadricep strength, you're going to be putting more stress on your ligaments and joint surfaces. Okay. So as previously mentioned, we did see an interaction for quad peak torque where the involved limb benefited more and saw an average of 8 Newton meters increase. Why did we see this? Well, it could be due to the fact that the theory that the motivational pillars we discussed earlier can help increase dopaminergic transmission, which also increases efferent drive to the muscles.
Okay, so what did optimal prep improve? So it improved quadricep and hamstring peak torque, like Ryan said, didn't have much of an effect on rate of force development. It improved right here. We provided graphs to let you see like how it improved. And out of our participants, there were 6 that had allografts, 4 that had hamstrings, and 3 that patellar. As you can see, the hamstring, both limbs improved, involved and non-involved, by 3 Newton meters, which is about 3%. And we would suggest that if a patient has a hamstring graft, it'd be beneficial to implement optimal prep. And along with the allograft, as you can see, there wasn't really much of an improvement with the involved limb. So maybe as optimal prep wouldn't be as beneficial in that graft.
So for clinical relevance, having some form of external focus can be extremely important. Like for instance, when we were testing for the biodex, have the patient see the bar or line so they can see kind of like what their force output is. And then like Levi just said, we did see an increase in both involved and uninvolved hamstring peak torque when they had a hamstring graft, but we would need a little bit more data to see how it can improve other graft types. And then when you're doing any kind of testing, whether it be rehab, strength testing, or like return to play, having feedback and choice might be beneficial for this force output. So like you could use this as an example if you're doing a single leg hop for distance rather than say jump as far as you can, maybe place some kind of focus like a cone or something and say jump as close to the cone as possible. And then these are references and we'll open it up for any questions.